Hey guys, it's Miss Reyes and Miss Ratcliffe. We're going to be going over your physical assessment skill. Remember, whenever you come in here and do this, be prepared. Make sure you're studying and watching the video.
Okay. All right. So the first thing you're going to do is you're going to provide privacy to your patient. Obviously, we want y'all to be able to see what we're doing. So, you would provide privacy, whether it be a curtain or a door, and then you're going to wash your hands. I'm gonna do some hand hygiene. We're also going to introduce ourselves to our patient and make sure they know who we are, and also make sure they know what we're doing. So we're going to be doing a physical assessment on you. My name is Lauren Ratcliffe, and I'm going to be touching you. Is that okay? And then you're also going to assess your patient's pain. So you want to ask your patient if they're in any pain and use an appropriate scale. So if you want to use the numeric pain scale, where you're asking them, will you please state your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, and our patient is in no pain today. If our patient was not able to speak to us, or they were not developmentally at an adult level, or a level where they were understand like numbers well, you could use the flat scale or a different scale. So make sure you're using an appropriate scale. And the next thing we're going to do is our vital signs on our patient. So we are going to, I'm going to sit my patient up. And you're not expected to do vital sign minute assessment, but I want to go over it real fast because you will be expected to do vital signs on your patients in the hospital, and you need to know how to take a manual blood pressure. So we're just going to go over it real quick. All right, the first thing you're going to do is you're going to check their radial pulse, okay? And you're going to need to make sure that you have a watch. And so you're actually checking their pulse, and you're going to be timing that for 1 minute and checking their pulse. So you're counting. And so we've got our patient's pulse, it's 65, and then we're gonna also count their respirations without telling them we're counting the respirations, because if you tell your patient you're counting their respirations, they're gonna start breathing all funky, right? So we're gonna count the respirations. Her respirations are 16, so we're good. All right, we've already assessed her pain. We're gonna get a pulse oximeter, and we're gonna check their oxygen saturation. So hers is 97, so she's doing great. We're gonna now do our blood pressure. So we need our blood pressure cuff and our stethoscope. We will have cleaned all of our items before we use them on every patient. Just because your stethoscope has been around your neck does not mean it is clean. So you need to wipe it off between every patient, okay? All right. So the first thing we're gonna do is we're gonna find our brachial pulse. Okay, so we're gonna locate the brachial pulse. Once we've located the brachial pulse, you're gonna see right here on your blood pressure cuff, you have a left arm and your right arm. So that's where you're gonna put that directly over that pulse you are feeling, okay? You wanna make sure you're using an appropriate size blood pressure cuff for your patient's arm. Okay. Then you're gonna put your stethoscope on that pulse you felt, okay? And we're not actually gonna see anything because our patient obviously does not have a blood pressure, but we're gonna walk through it. So then you're gonna go ahead and tighten this valve. You're gonna pump it up. Usually I go in like the 170s area and start releasing our little, I don't know what that's called. What would you call that? Knob slowly. And if you immediately hear a sound, you're gonna need to blow that blood pressure cuff up more, okay? So we're gonna pump it up. Okay. We're gonna slowly release, and we're gonna listen for that first sound, okay? So once you hear that first sound, say it was at 130, okay? That first sound is our systolic number, okay? And then we're gonna continue hearing sounds until we get our diastolic number, which will be the last sound, okay? And then you have your blood pressure. You need to make sure that you know how to do a manual, because anytime you're in a facility, you're gonna have your automatics, but your automatic is never gonna be as accurate as a manual blood pressure, okay? All right, so we're gonna go ahead and take that off. We're gonna move on with our physical assessment. All All right, the next thing we're going to do is ask our patient about their level of orientation. So we're going to ask them their name, their date of birth. Actually, in reality, we probably would have done that first because we want to make sure we're doing it on the correct patient, right? So we would ask our patient those two identifiers, their name and their date of birth. We'd also want to know if they know where they're at today. Do they know what time it is? Do they know who the president is? Those are things that are going to let us know that our patient is oriented and that neurologically there's nothing going on. Okay, so she's oriented. She knows where she's at, even though she has a blown pupil. Y'all just disregard that. All right, the next thing we're going to do is we're going to inspect our head. So obviously, as a nurse, you are just going to be looking at your patient and noticing all this stuff. I'm just going to talk you through it so you know kind of what I'm thinking. So we're going to look and we're inspecting, making sure that the face is symmetrical. We don't see any drooping of their face or anything like that. So she looks good. Obviously, we're going to disregard that pupil because we can't change it. All right, the next thing we're going to do is work on our eyes. So we're going to inspect our eyes first. We always inspect first. So we're inspecting our eyes. We're looking at them. Again, we're noticing that there is a blown pupil, but we're going to disregard that. Now we're going to do our perla. So we're going to need our pen light. Okay, so perla, we're going to do our pupil reaction first. So we're going to take our light. I'm going to shine this light into your eyes. And we're going to shine the light into one of the eyes. And we're looking for that pupil there to constrict, okay? Then we're going to do it again. And we're also looking for this pupil to constrict. This is called a consensual pupil reaction. If this one constricts, this one should constrict also. That means they're neurologically normal, okay? So then we're going to do the same thing over here. We're looking for this one to constrict. Again, that consensual. Here, this one should constrict, okay? Her pupils are equal, round, and reactive. Obviously, they're not, but we're going to pretend like they are. Now we're going to do our accommodation. Now, that is our A in our perla, and lots of people don't do accommodation, but they chart they did accommodation. So you need to make sure you do it if you're charting perla. All right, so we're going to ask our patient. Can you see my pen light?
Mm-hmm.
We're going to ask our patient to look at our pen light, and we're going to bring it into their nose. And we're looking for their pupils to converge, so their eyes should come together, and then we're also looking for their pupils to constrict. So we're going to bring it in like that. We should see her eyes crossing, looking at that, and the pupils should constrict, okay? Her accommodation is normal. The last thing we're going to do is our extraocular movements. So we need to make sure we tell our patient to look at our pen light, and we're going to move our pen light and only look with their eyes. So they're not going to move their head, they're only going to move their eyes. And we're going to do our 6 cardinal fields. We're going to look for them to track. Okay. So her eyes should be moving with my light. Okay, and these are our cranial nerves 3, 4, and 6. Great job, she tracked. So that is all normal findings for our patient. All right, so the last thing I'm gonna do for the eyes is I'm actually gonna put on gloves for this. I like to wear gloves when I'm working with my patients. All right, we're gonna look at her conjunctiva and make sure that it is appropriate. Okay, so we're gonna, hey, is it okay if I touch your eyes? Okay, we're just gonna pull down here. You know, you're gonna be looking inside for any redness or anything like that. It should be pink, but it shouldn't be very red. If it's red, we could have an infection or irritation. And if it's very pale, that could indicate that our patient could have an anemia. All right, so that is normal. The next thing we're gonna do, we're gonna move on to our ears and our nose. So we're just gonna inspect, we're looking. There's no abnormalities with the ears. Everything looks good, no drainage or anything like that. We're also checking the nose, looking for symmetry, asking them if they have any problems with that. Take my pen light. Gonna look up there and make sure I don't see anything abnormal. Okay, everything looks good there. All right, now we're gonna inspect our mouth. So again, we're gonna need our pen light for this. Can you open your mouth for me? Say ah. All right, so we're just looking, making sure there's no dental caries in there. We're looking for our hard and soft palate, making sure that the tongue doesn't look dry or cracked because that's a really good indicator of dehydration. Everything looks normal. We're also looking at that mucous membrane, making sure it's moist and making sure that it is pink also, making sure it's not pale or super red or anything like that. All right. All right, so we're also going to do our throat. We're inspecting our throat. We're looking and making sure that the trachea is midline. Everything looks good there. I keep looking over here because I'm wanting to make sure I go in the exact order that your sheet is so you kind of have a good flow of it. All right, the next thing we're gonna do is our carotid pulses, okay? So we never check our carotid pulses at the same time because that is the blood flow to the brain, and we're never gonna wanna cut our patient's blood flow off. So I'm gonna go ahead and I'm gonna feel one pulse. And then I'm gonna feel the other. Okay, all right, so you're looking for them to be equal, and you're also looking for them to be rhythmic. All right, everything looks good there. Go ahead and take my gloves off. All right, the next thing we are going to do is we're gonna move on to our heart. All right, so I'm actually going to move her gown down so we can see the chest, but you would wanna provide privacy and keep your patient covered as much as possible. Okay, so now we're gonna listen to your heart. All right, so we are, let's see here. Yeah, so we're gonna auscultate and palpate, okay? So we're gonna start out with our aortic. So it's gonna be on this side of the chest, on the second intercostal space. We're gonna listen. Then we're gonna move over to this side and we're gonna do our pulmonic, second intercostal space also. Then we're gonna move down one intercostal space to Erb's point. And then we're gonna move down one more time to our tricuspid. And then we're gonna move to our mitral valve or our apical pulse. And that is going to be our fifth intercostal space, mid-clavicular line. So I can't really pick her breast up, but it's gonna be kind of right down in there. I can't actually move her breast because it's plastic, but okay. And this whole time we're listening for our S1 and our S2. We're listening for any extra sounds. We're listening that our heart is rhythmic. And we can also, if you have a hard time hearing your patient's heart, you can ask them to turn on their left side, and that movement to the left side brings that heart forward and it makes it easier for you to be able to hear. You can also palpate. So you want to palpate your point of maximum impulse, which is our apical pulse or our mitral valve, and make sure that you could feel it. You should be able to feel it very good, especially on a smaller person like her. All right, so the next thing we're gonna do is we're gonna move on to our patient's lungs. So we're going to, I like to assess all the things I need to listen to at the same time. So I'm doing them all at once. I've kind of stopped in between to talk to y'all just because I wanna really go over what else you're looking for, but you should be able to do this. It should flow very, very well, unlike when I'm kind of breaking everything up. So the next thing we're gonna do is we're gonna look at the lungs. I'm gonna remove her shirt again because I wanna be able to show you exactly where I'm putting my stethoscope and what I'm doing, but you'd wanna provide a lot of privacy to your patient. So we're really gonna be looking at how her chest is moving. Is it symmetrical? Is she using any accessory muscles? Is she abdominal breathing? Is there intercostal pulling? And what I mean by that is, in the intercostal spaces, is it kind of sucking in as she breathes? Those are all signs of respiratory distress, and you need to be looking at that when you're checking your patient. So that is super, super important for you to tell us you're doing, because if you're not telling us, then we think you're not assessing that, okay? So she is breathing normally. Everything looks good. No accessory muscle use, no intercostal pulling. Now we're gonna listen. For your physical assessment, the big thing we care about is you covering all the lung fields. You don't necessarily have to do 6 spots or 8 spots, just cover all the lung fields, okay? So your lungs start up here, so we're gonna start here. All right, take a deep breath for me. And breathe out, okay? All right, so you are comparing sides. So you're gonna go from one side to the other side. Again, thank you. Again. Okay. Again. Okay, again. It's hard for me to move around because she's so plasticky, but you need to cover that whole lung field. Okay, we're also gonna hit these laterals really good. I like to do the upper lateral. Take another breath for me. Again. Okay, and another one. So I do 2 spots on each side. Great job. All right, so we're listening for any wheezing. We're listening for rhonchi. We're also listening for crackles. So make sure you note any of those sounds. Her lungs were clear and normal. So now we're gonna move to the back. So if you would mind sitting up for me. All right, so we've asked our patient to sit up. We're gonna do the same thing on the back. You need to be very careful that you're not listening over bone. So her scapula is here. We're gonna stay away from that. We're gonna try to stay away from the spine. We're gonna sit on the edge of the spine. We're moving from side to side again and comparing the sounds. So you should be making sure that you're hearing the same sound on each side, okay? All right, take a deep breath for me. Good job. Again. Good job. Another deep breath. Awesome. Okay, and when you're down here, make sure you hit these lower lobes because this is where you're gonna hear your crackles or your fluid at, okay? So make sure you're really listening here. You're also going to note the skin and everything while you're looking back here and make sure that if you notice anything abnormal that you address that. We're also looking for any type of abnormal breathing while the patient's sitting up or anything. Okay, everything looks normal. The next thing we're going to do is we're going to move on to our abdomen. So we're going to keep our patient covered and we're going to expose their abdomen. Okay. Okay, so the first thing we're gonna do is listen. So we divide it into 4 quadrants. I'm just gonna listen to your abdomen. You're listening until you hear a bowel sound. Shouldn't take very long. Okay. We hear bowel sounds in all 4 quadrants. If you were unable to hear a bowel sound, you would need to listen at least for 5 minutes to confirm there are no bowel sounds and then contact a provider immediately because that is a very abnormal finding. It would need to be addressed. Now we're going to, let's see here, I want to make sure I tell you this right. Lightly palpate. Another thing we would do obviously is inspect. So we're looking at our patient's abdomen, making sure there's no abnormal areas on the skin, making sure you don't see any like raised areas, like there may be like an internal like tumor or something where it's raised up. So you need to be assessing that. So we're gonna lightly palpate. We don't deep palpate, we lightly palpate. So we're gonna palpate lightly and let them know that if they're feeling any pain or tenderness, to let us know. All right, she has no pain or tenderness. Okay, all right, and we'll go ahead and cover her back up. Raise your arm. All right, the next thing we're gonna move on to is the skin. And if you've been listening, you know that we've already been assessing the skin. So from the minute you walk in the door, you're already looking at your patient's skin. But one thing we haven't seen yet are her legs. So we're gonna go ahead and cover her legs and make sure you let your patient know. All right, so we're looking at the skin. We're looking for any abrasions. We're looking for any wounds or sores. We're also looking for just a general skin color. You know, if your patient's cyanotic, that is an abnormal finding. So her skin looks normal. Now we're gonna check her skin turgor. There are 2 places we can do this on our patient. We can do it on our clavicle or on our hand. So here, right here by our clavicle here, you can pull up the skin and check your patient's skin turgor, and it will tell you if they're dehydrated or not. And the other place is on our hand. So like right here, you're gonna pull it up and you're gonna make sure that the skin goes down, like it's got a lot of elasticity. If you're dehydrated, it's going to do something called tinting, where it's just gonna stay up. Make sure you're testing your skin turgor on the appropriate places. What I mean by this is if I decide to test it on a knuckle, it's gonna tint, right? So don't do that because that's not an appropriate place to test your skin turgor. So make sure you're doing it on the hand or on the clavicle. All right, so we're gonna go ahead and move on to our cap refill and our pulses. You can really do your assessment any way you want. You have to cover all these areas, but learn how to do it in a rhythmic way where everything kind of flows, where you're not having to have your patient sit up 6 times. because then it's just a lot of extra for them to do, and it's not efficient for you either. And we know we don't have a lot of time to do things as nurses, so we want it to be as fast as possible. We already did our carotids, so now we're going to do our radial pulses. Okay, and all of your other pulses, you're going to be feeling them bilaterally at the same time. So you're feeling them to make sure they are the same. And you're also feeling to make sure they are rhythmic. If they're not rhythmic, we could have something going on with our heart that makes our heart not beat in a rhythmic way. All right. We also are doing our brachials. Okay. Your femorals, you are not going to be expected to do a femoral during your physical assessment, but you need to know where it is. So you can just state that. But your femoral is going to be right in this area right here that really doesn't exist on her. Okay, and then we have our popliteals. We're going to go down here and we're going to do our pedal pulses and our posterior, sorry y'all, pedal pulses and our posterior tibial pulses. A few things that are super important with your pulses is that you're actually finding them. If you don't know where your pulses are in your patients, sit there, spend the time, go feel pulses on your family members and find them. Spend the extra time to find them, because if you keep pretending, then eventually you're never gonna find them, and then you're not really doing a full assessment. It takes a little bit of time. It's a little bit of assessment is a skill. So you really need to practice. All right, so we are looking for them to be equal. We're also looking for them, if it is thready, we would call that a +1 pulse. A normal pulse is a +2 pulse. If it is bounding, it's gonna be a +3 pulse. It would mean that their vascular system may have a lot of extra fluid in it. So we need to make sure we're noting what we assess on our pulse. All right, I'm gonna walk back over here. We also need to do our cap refill, okay? So we're gonna test our cap refill on each extremity. And what we're looking for is we're just gonna push on our patient's nail, and we're looking for that, that blood to return. And I'll do it on myself. Y'all disregard my nails. I had fake nails on. They're not pretty now. So you're gonna push and you're looking for it to turn red. Okay, so you're looking for that blood to fill back up in those capillaries in an appropriate time. I think it's 3 seconds. Okay. All right. So the next thing we're going to do it on each extremity. Check in here. We've already checked that one. Now we're going to move down to our feet. What happens if your patient has their toes painted? How are you going to assess your cap refill? I want y'all to think about that for a second. All right. So you can always assess it on the back of one of your fingers or toes also. So you're pushing and you're looking for it to, see how it got white and it turned red? I think a lot of times you can see it better there than you can on the nail. So we've tested both of these. Okay, our cap refill is good, less than 3 seconds. The next thing we're gonna do is we're gonna look at our range of motion on our patient. So again, as a nurse, when we're walking in the door, we're already assessing those things. Did she sit up well? Did she go to the bathroom when I was here? If she walked to the bathroom, I know that she has enough strength to be able to hold herself up. So we're doing all of those sort of assessments constantly. So now we're gonna move on to our range of motion. We're gonna have our patient grab our fingers. Okay, can you please squeeze for me? Okay, she has good hand grasp. Okay, we're gonna get her to hold her hands up, and it's gonna be kind of hard because she obviously doesn't have muscles. So we're gonna ask our patient to push on our hands, and then we can also have them pull here. So pull back like that. That makes sense. All right. And then we'll also have her lift her elbows up and bend her elbows. She looks like she's got good range of motion here. I also saw her get up and go to the bathroom a minute ago, so I know that she's got enough strength to walk around and hold herself up. Okay, we're gonna do the same thing with her feet. We're gonna have you push on the back of my hands and then have you pull your toes up. Good job. Okay, can you bend your knee up? Awesome job. Okay, go back down. Any pain or tenderness? Okay. All right, so she looks like she's got great range of motion. She doesn't have any musculoskeletal abnormalities that I can see. The last thing I want y'all to be thinking about is your patient is in a hospital setting, usually they're going to have lines or tubes or something in their room. So it's very, very important that you assess those things on your initial assessment. Say she had an IV or she was supposed to be on oxygen. When you come in to do your assessment, you need to be checking that. So she needs to be on 2 liters nasal cannula. Do we have 2 liters nasal cannula on her? No. So it is your job at that point to follow those orders out. So you need to go get a nasal cannula and put her on 2 liters. We also need to make sure that our IV is not red or swollen or infiltrated. If she's on normal saline at 75 mils per hour, is she on normal saline at 75 mils per hour? So you need to be assessing all of those things. Does she have a Foley? Does it have urine in it? What does the urine look like? So all those things are an added addition to your physical assessment. If y'all have any questions, please let me know. Please read in your book. You have a really good chapter on physical assessment, and it really goes in depth for all the things you're going to need to know. Send me an email and let me know if you have any questions.